Hi, I'm Laura Flanders, and this is CityWorks, the show by, with, and about working people. CityWorks is a co-production of the School of Labor and Urban Studies at the City University of New York and CUNY TV. Today, we are going to be talking with a nurse and a doctor at the front line of today's COVID-19 struggle. Kelly Cabrera works at the Jacobi Medical Center in New York, and Frank Proscia is the president of the Doctors Council, which is an affiliate of the Service Employees International, the SEIU. But first, before we go to Frank and Kelly, we're going to take a bit of a glimpse of a web conference that happened at the school just recently, featuring, among others, Alexandria Ocasio-Cortez, the Congresswoman, talking about immigration and the challenges faced by migrant workers in these times, a workforce that is I think, are increasingly conscious of in this period of pandemic. So take a look at this, and we'll be back with Frank and Kelly right afterwards.
And welcome, everyone. Happy May Day. I'm pleased to report that there are over 1,300 people who have registered for the conference today, a really amazing turnout. This evening, we're thrilled to have a virtual town hall with leading labor and community leaders from New York and around the country, and two inspiring voices for change, Congresswomen Pramila Jayapal and Alexandria Ocasio-Cortez.
Our me first instead of we first society has been around for a while, but the pandemic is showing us more clearly than ever the costs of that kind of thinking. So let's use this moment to rethink the rhetoric and the politics of exclusion and imagine a more moral immigration system. The pandemic has opened our eyes to a message that we in the immigrant rights community have been sending for decades, that the work of immigrants is essential, that too often invisible work is now visible, as undocumented farm workers who live in fear of deportation pick the food that goes on our tables and in our food banks. DACA recipients and immigrants of all citizenship statuses helping to fight the spread of COVID-19 in our hospitals or care for our children, our elders, and so much more. There's a very perverse irony in that we call these roles essential, but we exclude workers from eligibility for direct stimulus checks, that we don't have safe working conditions to govern their safety, and the vast majority are still not eligible for healthcare in our broken for-profit healthcare system, even as data shows us, whatever data we have, that Black and brown folks have 2 times the rate of coronavirus as white folks. Just this week, a Gallup poll showed that tens of millions of US adults would avoid seeking potentially life-saving medical treatment for COVID-19 symptoms, even if they had the symptoms, due to fears about their ability to afford the costs of that. Everyone, no matter what their politics are, is now seeing how our fates are all interconnected. And more people are seeing the truth of our moral argument that you can't both be essential and treated this way. Protecting immigrants, granting them basic measures of humanity, decency, and healthcare is the moral thing to do, no matter what the circumstances. But even if you didn't agree with us on the morality, there is a selfish argument in the midst of a pandemic that allows us to bring in more people. Folks do not want the person on the front lines that's bagging their groceries or caring for hospitalized patients to be able to spread the virus. So there is an opening here for us as advocates to change minds and shape policy. That's why I've called for essential workers to be able to get a path to citizenship, to honor the work and contributions of their frontline work, in addition to the equipment standards and hazard pay they deserve. First of all, we got to guarantee paychecks and make sure that economic relief goes directly to people. So I've introduced a Paycheck Guarantee Act, and this is what every other major country in the world has done. And the thing is that it targets the lowest wage workers, and guess who those workers are? Many of them are immigrants, they're folks of color. That's who's being laid off. And rather than pushing them into unemployment, we want to keep them employed and tied to their workplace. So this would be a really significant advancement to be able to have the Treasury direct grants, not loans, not delivered by community banks that have never really done much for our communities of color, but direct from the federal government to the business. And it would be by revenue loss, and it would continue until our economy is back.
I would be remiss if I didn't acknowledge that today is May Day, a day of international worker solidarity, in which we acknowledge the contributions of all workers in the United States and around the world. And just a few hours ago, we were convening with a lot of our immigrant workers here in the community, nail salon workers, laundry workers, domestic workers, and so on, telling their stories, street vendors and more, about how really our entire economy depends on them. Our entire way of life depends on immigrant workers and our immigrant community overall. There was also Representative Ro Khanna there in that conversation with me, who had joined me, and he reminded me that about half of our farm workers in this country are undocumented. And that means every time, it's such a stark reminder that every time a person in this country goes to a grocery store, picks up some fruit or some produce, half of that produce was potentially touched by undocumented hands, which means that our entire country eats out of the hands of undocumented people, eats from the hands of undocumented people. And the notion that that is the present condition, while we allow so many people to be cut out of our systems, the very systems that they contribute to, the very systems that they uplift, the very school systems and public systems and stimulus systems that they fund, and that our undocumented neighbors and brothers and sisters pay more taxes than Amazon or Facebook or Walmart often do. And yet when we draft these stimulus packages, we just allow it to rain gifts upon the people who take advantage to our systems, while we short shrift those who contribute so much and get nothing in return. And this moment, as was so eloquently stated before, this is our moment where we can change that, where we can challenge our systems of supremacy, challenge our frames with which we legislate, and not just with immigration, but really with a broad range of social issues, whether it's healthcare, living wages, hazard pay, and so on. And it allows us to acknowledge, it allows our policy right now is a moment that, and an opportunity where we can finally bring our policy in accordance to reality. The reality of the contributions that undocumented people and all immigrant families make to our community, the reality of our broken healthcare system, the reality of the fact that people are not being paid in accordance with the value that they present to society. And of course, the reality of our broken immigration system. Our policy can be shifted to one that is humane, that acknowledges human rights, labor rights, and beyond. And so with that, I'm just so thrilled to join you all in figuring out all of the specificity and details of what that looks like. So many people sometimes are shocked by just the plain realities that they don't know about immigration. One of the biggest ones when I continue to repeat that undocumented people pay more in taxes in our country than Amazon does. It stops people in their tracks. And the reason it stops people in their tracks is because it dismantles the narratives of immigrants as takers. It dismantles the narratives of immigrants as people who do not contribute to society, who are strains on our resources. And in fact, it flips the table because we're the takers, because we are taking their resources. We are sending our kids to public school. We are paying our nurses and creating our healthcare social systems based on their taxes, and we give them nothing back. So, I think finding ways to not just rebut narratives and to say, no, that's wrong, but to actively flip them and say, actually, they're not takers. You might be, I might be. And we need to fix this system. And when you look at all of those narratives as immigrants, the other classic one that we're already seeing as a compromise is, oh, let's take green cards and make them for workers that we need, quote unquote, that we need, doctors and so on, this model minority myth. Well, don't we need to eat? Aren't farm workers essential? Don't we need, apples and fruits and all the food that we consume? Though that is just as essential as well. And also, debunking the myth of the unskilled worker, which COVID has largely done for us. Overnight, we went from unskilled and replaceable worker to essential worker. And people are exactly realizing how much they depend on the working class to eat. And when the working class falls, we will starve. And I think this moment has truly highlighted that and made that argument for us, but it's never, you can never remind people of that enough.
In some ways, our biggest asset in the US compared to every other nation in the world facing nativism is that we have electoral leverage by virtue of our numbers, but that leverage won't translate into power by magic. It requires skilled organizing. Lastly, immigrant rights has to be rerouted in the broader struggle for economic and social justice in the country. When this crisis can be the moment when immigrant workers unite with other workers to challenge the economic oligarchy that has been laid bare by the crisis. And that mass organizing will provide a springboard for the solidarity that clears the path for immigration reform.
So that was just a glimpse of a landmark web conference held at the School of Labor and Urban Studies at CUNY, the City University of New York, earlier this year. We're going to be hearing more about that topic in weeks to come. But right now, we're revisiting a subject that we talked about a few weeks back. In fact, just before the shutdown in New York, we talked to two nurses from the New York State Nurses Association about their fears for the future and the already stressed nature of the medical system in the city. The workload was already hard, now it is harder, as we're about to hear from Kelly Cabrera, who is a registered nurse at the Jacobi Medical Center in New York City. We're also joined by Frank Proscia. You may not know that doctors have a union, but they do, a council. A doctors' council, which is a national affiliate of the SEIU, the International Service Employees Service Employees Union. So let me bring you both to the stage, as it were, this virtual stage that we're all getting more and more used to. Let's start with you, Kelly. What is the story of the COVID epidemic in your life? When did you first hear about it? What were you first led to believe was coming down the pike for nurses, healthcare workers like yourself?
Yeah, thank you so much for having us. I think so I work in the emergency room. I think our first real, weekend where we felt that this was far more real than we'd been let on, I think was in the early weekends of March. So I want to say around like March 14th or so. We had heard, obviously we'd heard on the news that this was going on, that there's a possibility that there's COVID, and obviously with the first patients that we saw or we heard of in Seattle, it just, to us, it kind of felt really distant until that time in March. And then we really didn't have a lot of time in the sense of it kind of just went from, we would see a few scattered patients and then all of a sudden it just blew up. We were really, really worried, obviously, about the PPE situation. We didn't really understand why we had gone from, using a mask per patient to all of a sudden being told to use a mask for 5 days. And eventually Governor Cuomo did, put out the mandate saying a mask a day minimum. But it just became, it became more and more apparent to all of us that this wasn't just a facility problem. It wasn't just a Jacobi problem. This was a city problem, a statewide problem, and ultimately it's a national problem with the shortages of equipment. So yeah, early March was that time frame where really all of this became very real.
And you, Frank, what about your first acquaintance with COVID-19?
Thank you very much for having us also. The first occurrence occurred in early March. We were aware of the sporadic infections out in the West in February. And now we're learning that the first effect may have been in early February, not at late February, as people suspected. As she said, this hit us like a tsunami in mid-March. There were a few patients coming in, then more and more. And ultimately, that tsunami just overwhelmed the system. The system was not built to take care of emergencies, unfortunately. Because of economics, over years and years of fiscal restraint, they thought that it could be put on the back burner, that they'd be able to handle it. There were several MRTs that took place. There was downsizing of beds, staff, hospitals had closed down over time. They never imagined something like this. This is what some people call once in a century type of phenomena, but unfortunately it may happen more and more often than that.
But I've got to follow up on that, Frank. I mean, people listening to this are going to say, well, there was SARS, there was MERS, there was Ebola, there was AIDS. New York has lived through something like this before, if not exactly this. Why so unprepared?
It's not prepared for a mass infection like this occurred. Unlike influenza, unlike a lot of these other things that you're able to contain and secure, you could isolate people from it. Even the Ebola, which was quite deadly, you were able to isolate those individuals from others. This, it's unknown. How at first they're saying it's the large droplets. Now they say it could even be aerosolized and it could last in rooms for hours on end. So that's the infectivity of this far surpasses anything else that we ever encounter.
So Kelly, take us back to the front lines where you work. I should say that Jacobi Medical Center is in the Bronx, and there's no part of the world that has been harder hit than the Bronx, New York. I think I'm safe in saying that. If you were to take us into those early days where you work, what would we have seen? What were you dealing with?
Yeah, I mean, it was awful. I mean, we're in the Bronx, which has the worst health outcomes at baseline in the state, unfortunately. So you can imagine what that meant for our patients coming in with COVID, and we're seeing it now, the racial disparities. Our borough has suffered like almost twice the amount of death as other boroughs. Yeah, those days where it was like one after the other. The patients, all the symptoms were pretty similar. The ambulances were lining up. Everybody came in pretty much for the same thing. People were walking in through the front, our front triage area as well. Everybody, shortness of breath, fever, and just the criteria just changed so much based on these changing guidelines by the CDC, by the Department of Health. It just caused so much chaos and confusion, I think, at the beginning. And then eventually, ultimately, everybody ended up, we just assumed that everybody had it at that point. There was one instance where I was triaging a patient who, as you all, I'm sure, are aware, the level of 911 calls increased so much in that time frame. I remember I triaged a patient at 9 a.m, and I was told that they had called the night before for this patient. They had called the night before, and there'd been such a backlog. And I triaged her at 9 a.m, and she died by 12. So the amount of death that we are seeing, I work in a level 1 trauma center. It's not like death is new to me, but just this amount of it, it's unprecedented. We were putting, so many, I'm sure you've seen all these photos and stuff of body bags and all of that. So it's just been physically demanding, emotionally demanding. It's definitely something I wouldn't wish upon anybody, and it's been really hard.
Kelly, have you yourself been tested, and have you received trauma counseling?
I was tested 3 weeks ago. I was negative. We eventually got testing for our staff, which took some fighting to do because there's been a lack of testing, which is part of the issue coming all the way from the federal government.
So let me just get that straight. We're talking at the middle of May. You didn't get tested till towards the end of April.
Yeah, so April was when testing became available to all of our staff. Like the beginning of April was people who were symptomatic. Obviously, if people were symptomatic and sick and they were out of work, those people, were able to find testing in one way or another, depending on where they went. But yeah, as a citywide level, we were able to secure testing for our staff starting in April. So I did it towards the end of April because I wasn't displaying any symptoms. I did get swabbed. Fortunately, I was negative. A lot of my coworkers did end up getting sick. And it's a huge problem. I think there's a lot of undercounting as well because we didn't have a lot of tests. So who knows how many people got sick.
We're talking slightly as if this problem is less bad or we're on some kind of better curve. It's still terrible and it's likely to be for a long time. And as you've just described, we now have more sick healthcare providers than we did when we started. Talk about this moment, what you're facing. Are you still in a crisis? How would you describe that crisis? And what would have made this moment better if we had done it earlier?
Yeah, I think it's really important to look at the crucial time period between December and March. Like, why did it take us all the way till March? I am on the front lines. I am in the emergency room. Why did it take until March for us to start to really worry and try to plan around this? And it is a failure on the federal government. It's absolutely a failure. So many things stemmed from that. Right now in our emergency rooms, and it's been pretty common as far as I know across the city, we are seeing a lot less patients than we did before. A lot of that is attributed to the social distancing, which has been working. Unfortunately, we can't live like this forever. So, and obviously everybody wants to go back to normal, which, the conversation then needs to be like, what was normal before? Did our healthcare system function well before? Obviously not. We're seeing all the flaws play out now. And so our biggest battle right now, I think, is trying to prepare for what this reopening may look like. We need to ensure that we have adequate testing. We need contact tracing. We need all these measures to be put in place because we cannot make the same mistake twice. We're almost certain that there will be another wave, and there is a lot of fear. I mean, in terms of just general staffing. Right now, our emergency room has so many travel nurses that have been provided by FEMA, which we're very grateful for. We don't know when that will run out. We have to remember what we looked like, what most of the hospitals in New York looked like before. We never had enough nurses. What happens if this breaks out? All these travel nurses have to go to other places, and now we're left with our bare bone staffing, which is what we had before. So it's like all these fights that we've been having for years. We need to have adequate staffing. We want to make sure we have the proper places to set us to actually isolate patients properly, the testing. There's all of these things that didn't happen before that now we should really be utilizing this time to advocate for that. And it's really unfortunate that the states have had to be bidding against each other. Instead of having a national response, we've had to have this process where states are literally fighting over resources when we really should be combating this on a national scale. And unfortunately, we don't have that.
Are you afraid right now?
I am afraid that people, because the numbers have dropped, I'm afraid that people are equating this with everything being normal again, everything being okay. And the truth is, we still don't know so much about this virus. It's so incredibly new. We don't know. We don't know what long-term effects are. So many of my coworkers have gotten sick. I don't know what their livelihoods will be like in the future. And we don't know how many people have actually, have been able to isolate. And now when they come out, will they get sick? There is so much to still continue to fight for. And this is why unions are so important. I'm so grateful to have Naisna. I'm the president of the LBU there. I actually became president in February, right before all of this happened.
Bargaining unit.
Yeah, the bargaining unit. And I'm so grateful for this union to be able to use this to advocate for all of us. It's not just the nurses, it's the doctors, the clerks, the respiratory therapists, everybody in the hospital. We all need to be safe. If we're not all safe, then nobody's really safe.
That's Kelly Cabrera. Back to you, Frank. I was going to ask Kelly, what difference does the union make? I'm going to ask you to just tell us a tiny bit about the Doctors' Council, which I was not aware of until now.
We are a labor union just for physicians and dentists. We have doctors here in New York, New Jersey, Pennsylvania, and Illinois. We're getting calls from around the country. This COVID pandemic is emphasizing to the doctors that a lot of times doctors thought that they were well off, they did okay, they survived this and that, but their autonomy over the years would bring sporadic calls to us saying, they're losing the ability to treat people that they wanted this particular way because their employer is telling them they can't do that. They have to follow this protocol or what, even though it's against what they know, medically. Now this COVID, pandemic, it's showing the fragility of the whole system. Doctors are a cog on the wheel, just like any other employee. And this shows the frailty. When workers have to stand up and start advocating, start pushing back and fighting, that says something. Fortunately, unions create the bar that the non-union workers could try to achieve. I applaud what's happening in the New York City Council. They're pushing that, whistleblower legislation in terms of, a just cause provision, that if there's any healthcare workers that believe that there's something going wrong or awry at their facility, they could report it without losing their job. Fortunately for unions like NYSNA and Doctors Council SEIU, we have those protections built into our contracts. Non-union workers need those whistleblower legislation, and it's key.
Frank Proscia is the president of the Doctors Council SEIU. Kelly Cabrera works at the Jacobi Medical Center in the Bronx, New York. I want to thank you both for participating with me in CityWorks, the co-production of the City University of New York Television, that's CUNY TV, and the School of Labor and Urban Studies at the City University of New York. I thank you both. Be safe.